Hello, Laura Diaz here, founder owner of Greenwood Dental. Today I would like to discuss the indication for the combination of medication that I prescribe for patients with TMJ soreness. TMJ is the joint of the jaw, and with patients that they are in extreme pain because the muscles are constantly spasming and because the muscles are constantly engaged. And some of them are in so much pain that they cannot even wear a night guard, which is the mouth guard that helps you break the habit or reduce the habit of clenching and grinding. So the other option besides doing physical therapy, acupuncture, Botox injections, is prescription medication. And the prescription medication that I typically prescribe is a combination of two. One is called a Cataflam, 50 milligrams, which is a anti-inflammatory that has potassium in it. And what I was told and explained, the potassium, the function of potassium in the Cataflam is to relax the muscles, so the anti-inflammatory can actually reach the spasming muscle without blocking the anti-inflammatory. So what happens is the potassium relaxes the muscle, and then the anti-inflammatory goes in to help reduce the inflammation in that muscle, so the muscle can relax and the muscle can rejuvenate itself with the proper blood flow to the area so it can function again. What happens is when we engage a certain muscle over and over again, and let me explain how building a muscle works. So when you lift weights to build muscle, you lift enough weights in order to tear that muscle, and at the tear, hoping for the muscle to fill itself in to make even a bigger muscle. So some of the patients that cannot stop clenching, grinding, cannot reduce the engagement of a specific muscle, it will grow bigger. We have some female patients that have this beautiful, perfect square jaw, but they find themselves with clenching, grinding, their square jaw is getting more square. And the reason why, because this muscle right here, it will bulge out since it's constantly being used and constantly being engaged. And then you'll have even more square of a jaw, which is a larger jaw. And they feel like their jaw is swollen and their face is getting even rounder or even more off a sharp angle. So if you inject that muscle or that swollen muscle with Botox, that will relax and will thin out your face back into its original shape, or even thinner than what it used to be. So that's one thing, which is a Cataflam. It's anti-inflammatory. In addition to the Cataflam, I do add Soma. Soma is another muscle relaxant. It's better than Flexerol. Flexerol, I feel from the patient feedback, is very, very strong and it's harsh on the stomach. They created Soma, which is an amazing product, and it's a tablet that you can split into half or quarters if you are very sensitive to medication, and you can take it with a Cataflam. It's basically just relaxes the muscle so you're not constantly engaging, especially at night time, of clenching and grinding. Now, the combination of the Soma, which is a very gentle on the stomach too, I haven't had any complaint about GI side effect like the Flexerol. When we combine it with the Cataflam, it's just, marriage made in heaven. Basically, I've been prescribing that for the past 15 years, and I never had anybody complain about it was too harsh on my system. I'm very groggy when I wake up, and everybody loves the Cataflam because of the addition of the potassium, which is a very relaxing element to the muscle. So that is an option if you cannot wear a night guard because your opening is limited. Some patient can't even put the night guard in there, or you are in so much pain that you need prescription medication before you wear a night guard, or we can do the prescription medication and the Botox, or the Botox and a night guard, so we can combine it however we need to combine it in order for us to relieve the symptom. And also depends on the symptoms and depends on you guys. As you know, our brand is all about customizing the treatment, customizing your experience so you can have the best experience ever. That's it for today. We love you. Be safe and DS out.